through my halfway house owner. He had sent people here before, and I needed help, so he thought it would be a good program for me. I had been to treatment multiple times, and I had been sober for a little bit, and I relapsed and got kicked out of my halfway house. And so I flew home to Columbus, Ohio, and I used for 2 weeks, and I just felt spiritually dead. I didn't want to live life like that anymore. It was enough. So I got on a plane and came back. I like that it's a dual diagnosis because I have mental health issues as well, which I think is a big part of my using. They take care of that side as well and don't just approach it as like substance abuse. You know, they put you on medicine to help you. I like it because you go from like detox into like a fenced-in surrounding to like a transitional like living on how we do here in Pompano. So that is really helpful, and I've never been to a treatment center that keeps you this long, which helps a lot. I was really nervous. I was kind of like, I'm in rehab again. But once I settled in, I liked it. I liked the program and all of that. I don't really know if I have expectations coming into rehab other than, you know, like a smooth detox and like really friendly staff and just really helpful. Like the therapists are awesome. I think it exceeded it a lot because I guess I wasn't planning on staying this long, but like I've grown a lot since I've been here, a lot more than I have in any other treatment program. I definitely like that you have a one-bedroom apartment to yourself. You know, it teaches you that you have to clean up your space or you're living in it by yourself, and that helps a lot. I like, you know, that we have, it's almost like you're living out on your own, but you know, you're doing like an IOP program, which to me is really cool. So I like having a bedroom, my own kitchen, and you know, a living room, watch what I want on TV, can relax and have me time. The staff is really nice. I hang out with and talk with them, and they relate to you, and they don't look at you as patients. They look at you as normal people, you know, they don't judge you, and then the therapists are awesome. They've really helped me a lot. I've had a lot of one-on-one time with them, so it's been amazing. We wake up at 6 and get our medicine, and then leave at 7:45. We leave from the residence to come over to the main building to do our groups, and we have like an hour-and-a-half group, and then we get 15-minute breaks. You get a 45-minute lunch break, and you have 4 groups a day. It's actually pretty easy, and it goes by pretty fast. And then we either go to the gym or we go back to the residence. We have a little bit of time to eat dinner, and then we go to a meeting. Then we get back and we can hang out by the pool or just, you know, go to sleep, do whatever you choose. Like into like what the actual problem is, not just, oh, you have a substance problem. It's, you know, what's really the issue, and they try to tackle that so that you can kind of, you know, maybe not fix the problem completely, but you know, you're starting into it and you know what path you need to take to continue to fix the problem so you don't use substances to numb it anymore. Definitely the therapy and how important therapy is in my life, because I've never wanted to have a therapist. Anytime I've had a therapist, I'm like, oh, they don't know what they're talking about. But I've really like taken away that I do need therapy, and it helps so much, you know, and it's a big part of my recovery is to continue therapy, because I know for me, I really need that. You know, the 12-step program is awesome too, but I also need like a therapist, you know, helping and guiding me through and knowing what's going on in my head when I can't make sense of it. just be open-minded. When I came in, it was, oh, I'm just doing detox. Then it was, oh, I'm just staying 30 days. And then as I went along, I'm heading into almost 70-something days here, and I want to complete the 90 days. Just have an open mind and realize these people are just here to help you. And if you want to get better, you will get better.